Thailand has started a universal health coverage 17 years ago, and the number of Thai people who are covered by state-funded insurance have risen significantly since. This helps improve the well-being of people in Thailand across a range of dimensions, including a decrease in mortality rate, longer life expectancy, and fewer financial predicaments, to name a few. But that doesn't mean Thailand has solved all health-related challenges. For one, Thailand is among one of the first developing countries that is an aging society. Non-communicable diseases, or NCDs, are becoming more prevalent, and with limited resources, doctors and hospitals find it more difficult to look after these aging populations. Saratburi Provincial Administration Organization steps in to collaborate with health professionals, providing care to the elderly and reducing the workload of physicians and nurses at the same time.
The main idea is that we have a collaboration between the National Health Security Office, which has organizing the Universal Health Coverage Fund, together with the local authority at the provincial level.
This is the first time I am seeing it. I've seen it happening, and then I have more confidence that it's good. The financial security for the program too is good. So for me, it's a very excellent day, and it's a day well spent.
Another vulnerable group are prisoners. With too many inmates in many prisons, sometimes health professionals who work full-time there cannot keep up with the demands of those in jail. So, Samut Prakan Central Prison works together with Bang Bo Hospital to tackle this problem. The hospital provides healthcare resources to the prison, while at the same time receiving additional funds from the National Health Security Office, making this a win-win situation.
Because we concerned about the human rights, so every prisoner should have a right to health and breathe and promotion, everything that they should have. So we support everything that we can do, such as a doctor to take care and help and cure and everything, and dental service and care about the pregnancy matter.
I've been very impressed today coming to the prison and seeing how UHC covers not only everyone outside of prison but also within prison here in Thailand.
In Pathum Thani, Bung Yi Tho Medical and Rehabilitation Center, which was founded 35 years ago, has become an integral institution in the area. It provides healthcare to more than 32,000 residents, and with PD First policy, the center is now one of the best models in how to alleviate kidney disease.
We've had a wonderful visit here, and we've seen something very special going on. This center is really at the heart of a community movement. There's so much going on here, something for every age. There's a holistic approach to health, which is so impressive. We can feel the enthusiasm for the smallest children learning how to swim to our oldest neighbors that are dancing and having a great time. It really reaches a lot of the needs and is stimulating, and I think it's just a wonderful thing for our community, and we have a lot to learn about this example.
And knowing that community is essential in providing health care to those in need, Pak Chong Nana Hospital has established Primary Care Cluster, or PCC, soon after a universal health coverage in Thailand began 17 years ago. And because a number of the PCC staff come from people who live in the neighborhood, access to patients and providing health care and advice to those in the community become much easier, leading to a more effective treatment.
And I think here in Pak Chong what we learned was basically how the whole primary healthcare system is set up through the primary care units, how they work together in a vertical approach.
This is quite similar of what we are facing in Cameroon. So I really wanted to join the group to really learn from your model, because Thailand, the model of Thailand is very, very well known in the world city.
In Kanchanaburi, one-day surgery at Phahon Phon Payuha Sena Hospital has been practiced for more than 20 years. The hospital has already turned into a leading example of how to perform one-day surgery. In 2017, the hospital has opened a one-stop service center for one-day surgery. The practice helps hospitals to be better at managing hospital beds and is slowly changing the way on how surgery should be provided.
And I was very impressed by the practice of one-day surgery and how the event itself explained everything and all the details that we need to know, the advantages and the best practices. And I would love to, the event made me very motivated to take that knowledge and experience back to Egypt and to do the same in my own country and to implement this practice more.
So it's really a very interesting event because for us it's a lesson in how hospitals will be more effective in the way they design their programs and address their peculiar situation.
And at Poison Center, Mahidol University, we have seen how managing supplies of antidote and anti-venom well can lead to better health outcomes for all at a lower cost.
I think that because this drug is not used as much as usual, and as they are off-brand drugs, it should have the centralized system to manage them, that we can save the budget for purchasing the drug. And if we manage it well, it will be the share between the hospitals. And if we look out, it will be shared between country to country as well.
And finally, technology is also one of the most essential factors that help improve healthcare services in Thailand. At Bhumibol Hospital, an e-referral healthcare system developed by Nectech has been adopted in 2013. The system facilitates doctors at the hospital and at local clinics in the area, enabling them to share patients' information in real time.
E-referral is the convenience for the patient because we save the transportation for the patient to visit the clinic for documentation. We transfer everything from the document into the electronic to the application.
I think the primary healthcare trust is an example of how organizing the healthcare system and partnering between public and private providers can yield big dividends for the patients.